Hi, this is Alexandria, Minnesota chiropractor Dr. David Butler. In today's blog, I'm going to discuss the recent American College of Physicians guidelines for treatment of non-radicular lower back pain. Now you can click on the link at the bottom of this video to read the entire article. These guidelines were published in the February 14, 2017 Annals of Internal Medicine, and they are important because, as the report points out, lower back pain is still one of the most common reasons for physician visits in the United States, and most Americans have experienced lower back pain, and approximately 1/4 of U.S. citizens reported having lower back pain lasting at least one day in the past 3 months. Now, these new recommendations are based on evidence-based clinical research, and they state that physicians and patients should treat acute, subacute, and chronic lower back pain very differently than the current model. In these guidelines, acute was defined as pain lasting 4 weeks, subacute was from 4 to 12 weeks, and chronic pain was lasting longer than 12 weeks. These new guidelines recommend treatment with non-drug therapies such as spinal adjustments and exercise. And the guidelines state for the treatment of chronic lower back pain, physicians should select therapies that have the fewest harms and costs, since there were no clear comparative advantages for most treatments compared to one another. And, quote, physicians should avoid prescribing unnecessary tests and costly and potentially harmful drugs, especially narcotics, for these patients. The recommendations go on to suggest that physicians should consider opioids as a last option for treatment, and only in those patients who have failed other therapies, as they are associated with substantial harms, including the risk of addiction or accidental overdose. Now, maybe I'm being cynical here, but perhaps Prince and a lot of other folks would still be with us if these risks would have been recognized earlier. I'm hoping these guidelines will encourage more people to try conservative, natural approaches first, and that their medical providers will read and follow these recommendations before referring the patients to the surgeons. Now, over the past 30 years, I and the caring and skilled team at Chiropractic have had the opportunity to successfully help a lot of folks with a variety of spinal conditions, including radicular and the non-radicular back pain mentioned in this article. We are the only facility in the Alexandria Lakes area and central Minnesota to combine and utilize corrective chiropractic care, rehabilitative exercises, non-surgical spinal decompression, whole body vibration, and laser therapy to help treat, improve, and restore spinal function. If you would like to learn more about how you can regain you and your family's health, or if you know someone who wants to get out of pain and regain their health and wellness, please visit backfeelsgreat.com or call 320-762-0667 to schedule a free consultation to see if corrective chiropractic care can help you get on that path. Thanks again for watching. This is Dr. David Butler wishing you good health.